Call to order the public safety meeting of September 22nd. Oh, it's being live streamed. Sorry, forgot about that. Thanks, Melissa. Details. I'm officially calling the September 22nd public safety 8 a.m. meeting to order. If we could all rise, and Chief, thanks for having the flag. If you go ahead and lead us in the pledge.
I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation,
under God, indivisible,
with liberty and justice for all.
Thank you, Chief.
Thank you.
All right, we will get right to it. We had some public comments emailed to all of us, so I hope that everybody got a chance to read those. Melissa, Maria, I don't believe we have anybody on the line to participate in public audience. Is that correct?
That's correct.
Okay. But as always, and as part of our procedures here at both Public Safety and the Board of Selectmen, we do accept written comments and do distribute those to all members of this committee. So with that, we will move to the minutes, the approval of the June 16th minutes. Questions, objections, changes, updates? Alrighty, those minutes will stand. Thank you. And we will move right to Farmington Valley Health District. Do we have, I saw that Melissa was tentative, and I don't believe Jennifer's here, right? Okay.
I don't see Jennifer.
Okay. All right. We'll table that for now, and if Jennifer or Melissa joins us, we will go to that. So we'll go to the boss, town manager's office. Maria.
Great, thanks. I will be brief this morning, and I can probably fill in on a few health district updates. They are still providing COVID vaccines and boosters to people ages 18 and over. I believe they're offering those boosters and vaccines on Mondays and Fridays at their Canton location. So if folks are interested in receiving that service, that is something that you can sign up online or call their office to set up those appointments. This year, they're also offering on-site flu clinics for businesses. If you are an employer with 10 or more people, they are able to now provide flu vaccines to you on-site at your place of business as well. And then from the town manager's office, I would just say that I think we had a really interesting meeting with Frontier recently. There's some work that's going to be happening in town, but I'll probably defer and maybe might cover that under sort of the broader emergency management umbrella this morning.
I can't wait. That was a good teaser. That's like a video teaser. Back after this, we'll update you. All right. All right. Thanks for the town manager's update. So we'll move right to emergency management. Mike Barry.
Good morning, everybody.
Morning.
Welcome to fall.
Yes.
Yes, and it's also hurricane season. We have passed the midway point of the hurricane season, and luckily we have had a quiet hurricane season, but that does not mean that anybody should be resting on their laurels. Yes, I'm knocking on wood all over the place here tonight. I'll be doing that throughout my speech here. Just want to make sure everybody's got their go kits ready to go. They have their plans in case they have to hunker down or either leave their place of residence. Just make sure that you have all your kits ready. Pardon the weather. You're going to hear thunder in the background. I've got a pretty large cell right over the top of my house right now. So despite the fact that we do have a thunderstorm right now, we have had a pretty quiet thunderstorm and hurricane season. But that does not mean that we should not be watching the weather forecasts, and we are starting to get active with a couple storms that are out there right now. The Emergency Management participates in a weekly National Weather Service briefing. So we are keeping tabs on everything that's going on with the National Weather Service directly. And we've also been monitoring the river levels. I know that the river levels have been very much down and preventing some recreation. I know that I've gotten lots of reports of kayaks bottoming out as they're trying to go down the river. So even though it's a little bit low, some people are still trying to participate and have a good time on the river. The emergency operations plan review is going smoothly, and we've been requested to add a couple annexes to it, dealing with heat emergencies, cold emergencies, and a couple others. Those are in draft form at this point and being passed around for review. Once they are more solidified, they'll be sent out to the group. before they get approved and they get put into the emergency operations plan for permanent. We've been working with other agencies involved with cybersecurity. I am on a cybersecurity network, and the ransomware attacks and different attacks on municipalities and school systems has increased dramatically over the last year or so. We are working with Maria's office on coming up with a exercise for the group. I have been pleased to find out that every time we come up with an idea for the exercise, we've already got that covered. So if I throw something out there, I don't want to throw a softball to everybody. I want to make sure that we really test our system to make sure it works. But from the results I'm getting from talking to people, the town is pretty protected with the different servers that we have throughout the town. So I'm very pleased about that. But that does not mean we're not going to continue working to improve our security to make sure everything is tightened down as best we can. We are also working with social services on coming up with a sheltering plan and exercise coming up in the near future. Hopefully it will have a tabletop in the near future. We'll be keeping you guys advised with that. We recently had a problem with WSIM, our radio station in town, 103.5. Turn it to your dial, please. We'd love to have you listening in. We were streaming last week, but we had a problem with our transmitter and we weren't transmitting. If anybody notices a problem with WSIM, please let us know ahead of time, as soon as possible, so we can get someone out there to take a look at the system. People were enjoying our music online, but unfortunately, the people that had regular radios were unable to listen for a short time until we got it back up. So listen to WSIM and keep that going. Now, what Maria was alluding to is we had a very good meeting with Frontier recently. They came through and gave us a plan of what they're doing with town, bringing fiber to the entire town and offering services for that for residents. But the main concern that we had with it was how is they going to respond in case of an emergency. We've had problems with them with communication prior to a storm, during the storm, and then after during the recovery phase. And we asked them if they could model their system after what we've done with Eversource. And we have a fantastic relationship with Eversource now and getting things back up and running. We were asking if they could model something after that, and they said that they would look into it. They have given us more contact information with people that we can contact during and after storms so that we can have better response and better communication on restoration. Also, we've trying to make communication with them to try to clean up some of the areas that have been complaints with lots of extra wire kicking around and some duplication of poles and that kind of thing. So we have a better communication with Frontier. We're looking forward to working with them on a better basis, and hopefully we can have cooperation like we have with Eversource. I recently met with Eversource talking about making sure we have all the updates of what's going on with their division and their preparations for the hurricane season. And I'm very pleased with Mark Massaro and his work with everything, and then his communication with us and the communication. We had a recent storm where we had some power outages in town. One phone call to them through our normal channels, and then a call following up behind the scenes, calling our numbers, got the information we needed, got them to where they needed to go. And then there was one switch that needed to be thrown because the police station and fire station were still out of power. But we made one phone call to them for that, and the power was restored to that. So we're very pleased with how we're working with Eversource, and we're looking forward to working with Frontier the same way. With that, I think that's all I've got, other than just one thing going on the Farmington Valley Health District. We have been getting calls recently since there's been a slight uptick in the COVID cases because it's starting to get cooler and people are going to be closing up the windows. We have expended all of our available test kits, and the state is not providing any more at this time. So if you need test kits, you can go to the federal website and get test kits delivered to your residents. And but unfortunately, we don't have any more to pass out. So with that, I will turn it back to you. Thank you.
Mike, thanks for the update, and I appreciate that. And I can tell you, having been here for a long time, it is really good to hear that we have such a strong relationship with Eversource, because in the past, I think that topic has dominated this meeting for years. And for those of us that have been here, we know how challenging that is. So I think that's critically important. Sadly, it's as a result of a lot of events, right? But I think we've all used those to the best of our abilities to make sure that we've improved it. And it is heartening to hear that Frontier's coming in with that fiber connection. But I think this group does share the same concerns you and Maria are alluding to, and that we need to bring that responsiveness up up to speed. It was a challenge with Frontier's predecessor and continues to be a challenge here. So,
Yep. I
Any
was
questions?
unaware that Frontier was the old SNET, so that was a new education for me.
yes, yes, it's we'll just leave it at that. So, all right. Any questions for Mike? All right, we'll move right on to police. Chief Bolter.
Hi, thank you. Good morning, everybody. I just wanted to first thank Gary Wilcox and Jim Baldus for their efforts in the recognition of the firefighters, the dispatcher, and the police officers for the July 6th house fire. If you were not able to see any of the footage of that, please visit our Facebook page where you can see some of the segments of video that WFSB had put together for us. Some really good footage to see what actually happened there. But they put on a very, very nice recognition ceremony. So thank you very much for that. Nothing else to report from the police side. I'll be here for the entire meeting. So if there's any specific questions, please don't hesitate. Thank you.
Chief, appreciate that. Thank you. And thank you for the reminder for that ceremony. I'm sure we'll hit that on fire. Jennifer, I believe you've joined us. Do you want to go ahead and jump in on the health district side?
Sure, sorry I'm late.
No, no problem at all.
It was kind of an interesting ride in the storms this morning.
Yes.
So Farmington Valley Health District is offering the new bivariant booster vaccines out of a clinic located in our Canton office on Mondays and Fridays. I'll share with Maria the information to register. We'll also accept some walk-ins. We're also, so that's available to us. We also are going to be offering flu vaccine. We are not going to duplicate the efforts, the longstanding efforts of the VNA, but are targeting small businesses. It's going to be more important this year for people to get flu vaccine, just because we're going to have both the COVID and flu circulating. And typically working adults tend to have less uptake on flu vaccine than some of our other populations. So, you know, targeting small businesses, if they'd like us to come, we'd like to increase vaccination rates in that regard. We continue to post the COVID report on our website weekly. It gets posted on, it was getting posted on Friday afternoons. It'll be posted on Mondays just to keep everybody apprised of where we are relative to community transmission. There are some caveats to that data, and that is it does not represent home test kits, just lab confirmed test kits. And we know that there is a lot of home testing going on. We continue to work very closely with all 10 of our school systems regarding protocols with respect to both individuals that have tested positive, as well as tracking and monitoring and hopefully stopping small outbreaks and clusters within congregate settings. One other activity unrelated to public safety, but a very important endeavor that the health department has been working on is our community health assessment. This is a document that summarizes the health status of our communities and the risk factors that contribute to premature morbidity and mortality. We've got a draft version of that. Nancy's been on the advisory committee, and over the next few months, we'll be doing kind of community forums, sharing that data with the goal of developing a health improvement plan for the Farmington Valley. One last thing that I want to mention that is related, and maybe our first responders are aware of this. Peter Canning out of Yukon, who some of you know is involved in emergency medical services, has received Narcan test kits. He's going to be making those available to our first responders who respond to an overdose. These kits can be used to distribute to family members or friends who may be present during that overdose to make sure that they have access. And we've also provided some educational materials in the packet regarding where individuals can get refills, what is Narcan, what is an opioid, and some resources available to friends and family who have just gone through that. So we're very glad to be collaborating on that type of initiative, and we'll be working closely with our emergency medical services throughout the towns just to see how it's going, what the uptake is, et cetera. So a new kind of pilot project that's been launched in the last week or so. And that's it for me. Thanks.
Jennifer, appreciate that. Any questions?
I have a quick question for Jennifer.
Sure.
Hey, Jennifer, has the health district heard anything about, we obviously still have people that get COVID. Everybody is geared up to manage that. Community seems to be pretty good with all the protocols these days. And we know that flu is already in Connecticut in certain cases. But recently what we've seen going around, and it's been throwing people off, kind of questioning whether or not their COVID tests are actually valid. There's a cold that's going around that's very COVID-like. In fact, I was sure I had COVID because I had fever, I had chills, I had all of the symptoms, and repeated COVID tests were negative. And then I had heard throughout the state that there was this kind of cold syndrome going around that was very COVID-like. Have you heard anything or had questions about that?
I've not heard. We do know that the home test kits, you kind of have to hit that sweet spot to get the positive result. That's why we recommend periodic testing, 3 days, 5 days post-symptom onset. Haven't heard, but I'll listen, and if I hear anything, Nancy, I'll let you know.
Okay, no problem. I mean, it's easy to manage and whatnot, and I know common cold's a coronavirus anyway, but it is very interesting. It mimics the symptoms, but even with all the intermittent testing, and we've done tons of it, it's everyone's still COVID negative. So it's just very odd, but
yeah, I can, my uneducated is, we had two Ask 'em daughters experience the same thing, Nancy, no COVID. I mean, we tested them 6 times. So same symptoms. So
yeah, it's very, I mean, I've never had a fever with a cold before, but, and I was sure, I mean, I kept myself home. I did everything I needed to do, and it passed and it was no big deal, but, it was very, interesting. And it only was when I talked to my other colleagues and throughout the state that people were seeing this going around. So just share with everyone.
And then we'll layer on top of that flu, where you typically do have a fever, but other symptoms like body aches and sometimes nausea. So we're going to have multiple things going on during the fall and winter season for sure.
And I do want to just quickly give the health district a huge shout out. This community assessment project that they have been working on, that I've seen the draft finally come together on paper. It's a huge undertaking. It's a thorough assessment of all the community, of all the age groups, of all the risks. It really tries to identify where there's inequities, what we can do. And you guys have done an incredible job. That project just blew me away when I looked at it on paper.
Thank you, Nancy. Yeah, it'll be nice to be able to launch it for sure.
Yeah.
It's a good reminder, and Nancy, in your question there, a reminder that if you do feel sick, everybody should stay home. I know this group knows that, but that COVID or not, we can help keep each other healthy.
Right.
All right. I was remiss. I skipped Commissioner Long. I just want to make sure that Mike, nothing from the police commission.
No, that's fine. We're very pleased with the same program that the chief spoke about for the first responders. That was terrific for them. Thank you.
Okay. All right. Thank you, sir. All right. Karen, ambulance. Morning.
Morning. Happy fall, everybody. Not quite the best start to the fall, but we'll take the cooler temperatures. I do want to say, Jennifer, I've actually already spoken with Peter Canning, and we are on board with getting those leave behind kits. We also have approval from our medical control to be able to do that. So I'm pretty excited to be able to have that to help our residents if they're having any issues with the opioid crisis. So one of the discussions that has been going on with the Board of Selectmen is as for SVA to provide our numbers on a quarterly basis. So today I'm actually going to go through the numbers that go through August of 2022, which I will do shortly. But first I want to bring up a safety concern that I had over the weekend. I was on duty and responded to a medical call at the Arts and Crafts Festival. I'm not sure if we've had a setup where those tents are in the back of the stage in the past, but for us to access that was very difficult. We were guided in off of Iron Horse, had to go around the parking lot and through the tents with multiple pedestrians and children walking around without any really situational awareness. We had our lights on, but obviously we couldn't use our sirens. But as slowly as we went, I was still extremely nervous that we were able to get through that safely. So I would like to suggest maybe in the future, if we have events where the tents are set up back there, that the emergency access comes off of Iron Horse past the dog park instead of through the main entrance to Iron Horse. And we can discuss that later, but it was a little bit unnerving. Everything's fine.
That's good feedback, Maria. We should share that with Missy over at the PAC, and as part of the public gathering permit process, perhaps just incorporate that in the future.
Yeah, absolutely. I mean, we did err on the side of caution, but it was not the best way for us to be able to go in, or even if anybody else had to go in, they might not be aware that you turn the corner and suddenly you're in the middle of a festival. So that wasn't the best thing.
Okay.
So a couple of things, we're meeting with our dispatchers and with the police department to review the EMD, which is the emergency medical dispatch system, to try to update the process to ensure that our units are being properly dispatched and appropriately dispatched to calls in the future. I don't think this has been looked at for quite a few years, so we're trying to update that along with our medical control. We actually will be holding an EMT class in January. We'll be posting more information about that. And then now on to the call data, which I'm sure you all have been waiting for with bated breath. From January to August, these are our current stats. The total medical 911 calls that the dispatchers received were 850 calls, which is up 13% from 2021, without even the year being done yet. So obviously we're going to get higher. Of those calls, SVA was actually dispatched to 1,599 calls, which is up 15% from 2021. Our transports, 1,004 were transported, which is an increase of 11%. And our refusal non-transports were 595. In 2021, we had 463. So we have an increase of 132 non-billable calls that SVA responded to.
Karen, can you just go back? I'm sorry, Can you just go back? So the January through August, the total call volume was what again?
For the 911 calls or total?
Correct. Yes.
Yeah, the total medical calls were 1,850.
All right, I missed the one. I thought I heard 800.
No.
Wait a minute.
A one is there for sure.
Yeah, there we go. Just making sure I heard it right. Thank you. Sorry for the interruption. I just want to
no worries.
I had captured those numbers right.
And so one of the other areas that's of interest to the public and to the safety committee is the mutual aid calls. So in 2021, 386 calls were required mutual aid into our town, and which is a 15% of the overall calls that were received. In addition, we responded out of town to mutual aid calls 237 times, which works out to be about 9% of the calls received total. In 2022 through August, 268 calls were required mutual aid, and SVA responded to 135 calls out to mutual aid. I know these are a lot of numbers, but it just gives you the idea that we have a consistent give and take with our mutual aid friends. So while they are coming into our town, you have to remember that our population obviously is larger. We have our 3 nursing homes, but we are available to reciprocate and give them mutual aid as well.
So the 386 was last year's.
And that's this year's. That's today.
And that's 15%. Okay.
Yeah. So
okay. Thank you.
And which has been a pretty average number. I actually picked a random month. I picked in November of 2019 and did the analysis just on a whim, and the percentages were actually the same. So, but the call volume is different. So but the percentage were the same. So that really hasn't changed very much. The second thing I want to bring up was our second response unit, which we presented to the board earlier this month. And I want to say that for the month of September, all but 3 days have had car 17 scheduled as per what we discussed. We are currently fully staffed. We have 5 full-time paramedics and 4 per diem. We also have 3 full-time EMTs and 5 per diem. And we actually have a waiting list for people that want to come work for us that we haven't been able to onboard just yet.
Okay.
So this has allowed us to meet the expectations of the second response unit program going forward. And I'm very optimistic that we'll be able to do that over the future time with our association.
And then any insight into the 3 days where it wasn't staffed?
It actually was prior to having some of the hiring. We had a little bit of a delay and some people had to give their notice to their previous employers before they could start with us. So,
Okay.
but it was always in the works. So.
All right, so is it sufficient to say that basically in the last 2 weeks, car 17 is 100% staffed?
Absolutely.
Okay.
Absolutely.
That's
So-
important to know. I appreciate that update. Okay.
Yep.
And then are you keeping, and again, we don't necessarily do it here, this could be a follow-up. Has there been call volume hitting car 17? Has it been utilized during that 7 to 7 as expected?
Yes, it has. Absolutely.
Okay, obviously we had a tour and obviously both ambulances were out during the tour. So we
It was.
saw firsthand that 17 was out. But you know, that's an important piece is tracking that 7 to 7 that we're talking about staffing it right. And sadly there are calls, but that's what we're looking for is to see, you know, when it's being utilized and is it that 7 to 7 and are there spikes outside of that 7 to 7 that we perhaps need to talk about in the future, right?
Oh, absolutely. And we do the analysis again. I go over it every month when I get the information from Greg, which is lines and lines of Excel data, which is a lot of fun to go through. Not, but it at least gives me an insight into beyond what we do. It gives me all the mutual aid calls and that I may not have record for, which the dispatch follows. So I'm able to actually look at the whole picture of what Simsbury is actually getting in terms of 911 requests and calls for service. And I will say having the second ambulance was great the other day. We actually had a cardiac arrest over on Iron Horse at the pub and both units were able to respond immediately. Unfortunately, the outcome was not good, but we had the staff to be able to manage that call and to transport the patient to the hospital. So our guys are really working well together, which is really nice.
It's sad for the outcome, but appreciate that the response is effective. If you were to be able to just to send your update to the town manager's office so that we can include those numbers in the minutes.
Oh, absolutely. There are more numbers than you're ever going to want to see.
Yeah, no, I appreciate it, but just obviously there's a lot there in percentages, and I know you have a good handle on it. For the rest of us that are slow on note taking, just make sure that we have those for the minutes so that we're accurately displaying what we just talked about.
Yeah, I do have the breakdown by month for the whole year. I can provide that as well if somebody wants to peruse those numbers.
Yeah, no, I would appreciate that. Yeah, I think it's important, and I know, I mean, you've got good insight into it, but as we've been talking about, you know, car 17 in particular a lot for the last number of months, and the new plan in place, and perhaps just I know everybody here is probably aware of it, but it's good to just share with the public. Could you just talk about how you're staffing 17 in terms of the 3 categories of response?
Oh, absolutely, sure. So the idea is that, and again, we're very lucky right now to have our staffing as well as it is right now. So we basically have 3 models for the second response unit. One would be the classic ALS unit, which would be a paramedic and an EMT on the ambulance. The second option is to have 2 EMTs on that ambulance, which provides a basic life supports response. Again, I don't want to tell people they don't know the difference between the paramedic and the EMT, but paramedics obviously are able to do EKGs, give medications, intubate, much more advanced life-saving techniques. The last choice would be to have a paramedic in our intercept vehicle, which is our fly car, which then allows us to at least have a advanced ALS response to a call if we have to wait for an outside a mutual aid transport unit. So the person will receive immediate care from a paramedic while waiting for the unit to actually transport.
And that's really important because all along we've been talking about the right person or persons responding, right? So that ALS paramedic responding is the ideal situation, right? And then transport comes next, and it's certainly important.
Yeah.
But the fact that an ambulance showed us up isn't necessarily what makes the difference. It's who shows up, right? So we need to make sure that, and I appreciate the
Absolutely,
way you're articulating it. And then could you also talk about it? And again, I know you've been thoughtful with how you're responding on first call as well, right? Where the ALS paramedic is going, but in the fly car, and then perhaps coming back to wait for a second call versus being
Correct.
always tied up going to Hartford.
So actually, this ties into the evaluation of the EMD process with the police department, is to make sure that the right people are being sent to the right call. So if we have both ambulances staffed during the day, if a call is dispatched with that's potentially a paramedic call, the EMTs will go in the ambulance, the paramedic will go in the fly car. If it turns out that the call needs a paramedic, the paramedic will then go on that call and that EMT will come back so that we have another staff person in the building. If it's a BLS or a basic life support call, the 2 EMTs will take the call and the paramedic will come back. So the goal is to keep as many people in town as possible based on the need of the patient. So we're not sacrificing any patient care. We're giving the town what they need. And I think people have to understand that not every time do you need a paramedic for a call, even though it's dispatched that way. So once we get on scene, we evaluate the patient's condition and determine what they need and make the best choice for the care that they need to have to go to the hospital.
No, and I appreciate that, Karen. And I think that's really important to then improving the 17 staffing and dispatch, as you talked about, right? Because if you're sending out the paramedic again on a fly car, and again, you then bring them home, right? You have the ability to then send them out on 17 when that second call comes in and do the same thing. So the two are, I think, really important to addressing some of the things that we've been talking about for the last months in terms of how we're responding to call volume. So I'm looking forward to continuing to see how this works out. And then continuing to have a discussion and make changes and tweaks where needed. But I think it's an overall thoughtful response to how our town is growing and how EMS service is evolving, right? So
exactly. And what's actually good about having that paramedic or EMT come back is if I am actually in the office, which is very often, is I'd be able to create a third crew. So we do have a third ambulance. So we had that happen the other day where we actually were able to get 18 out on the road. And I took a little bit of joy to be able to sign on with CMed and saying 128 Alpha 3 is responding to a call. So that's another reason to be able to do that too. We can make a third crew if possible.
no, I think that's really important, right? As our call volume tends to be clustered during that 7 to 7, as you all know all too well, right? So, okay.
Yes. Yep.
All right, I just dominated a lot of the questions, but anyone else questions for Karen? I appreciate the update.
This is Jennifer. Can I just ask a quick question?
Please.
The uncompensated calls, I can't remember how many, but I think it was in the 500s that refused transport. Do you know what proportion of those are lift assists? Is it a significant proportion?
To be honest, off the top of my head, I couldn't say that. It feels like that's the proportion. That's the largest proportion. And then we actually can start billing for those, which we finally have permission to do that. It's just very difficult to meet the requirements to be able to bill for that. It's a nominal amount of money, but it is there for us to bill.
Yeah. So one of the reasons I ask is we have obviously those individuals are at greater risk of subsequent falls. We have a fall prevention program, and we're really looking to launch a pilot project where when these lift assists occur, those individuals are triaged and referred into a fall prevention program. So I'd like to maybe follow up with you at some point about what that might look like.
That would be great, because there have been several times when we've been in homes where we've looked around and saying, you can't live like this is not safe for you. You need to have, grab hold bars or whatever in your bathroom or things like that. Or if they're upstairs, they need to really be downstairs and things like that. So absolutely, we'd be happy to coordinate that with you.
All right, I'll follow up with you. Thanks.
All right,
Jennifer,
sounds good.
on the same note with that, Jennifer, we have a program in the fire department. It's actually used to be called the Remembering When. It's actually on fall and injury prevention for senior adults. We've actually had that program in town for several years. It's been very successful. We have just updated it through the National Fire Protection Association, changed the name a little bit and added some medications, some other identifiers that we realized occur with the falls and everything else. So working with both your agencies, we have been doing that. We have very a good success so far with it. So the steps to safety, which should be launched any minute now, is going to be out there, and we already are fully trained in it, and we'd love to work with both your agencies and have participation. This is a community-wide event. It's not the fire department doing it. It's actually, we need everybody's help to make this work.
Yeah,
So we'd
absolutely.
love to have that conversation with you guys as well.
All right, great. I'll follow up and you'll be looped in. We don't want to repeat anything that's already being done, but maybe collectively we can make sure we're reaching the greatest populations at highest risk. So thanks, Patrick.
Yeah, that's great, Patrick. Thank you.
Well,
John,
and
can you just-
if I could just add, I think I'm on, yeah. I mean, obviously, we have to track falls. We have a huge program as well. We also do, because I don't know, Jennifer, how far you guys go, but if you needed assistance or further bodies, we do send out our occupational therapists and physical therapists to do home safety assessments in the event that anybody has concerns about people in our communities. We could certainly most likely do that in coordination with your program to try to help them see in their house what they should change, what they should do. So if we could be an added layer to that, just let us know.
And that training actually came out too also. We've worked with you guys as well. And that's how our smoke alarm program actually started after 2 fatal fires here in Simsbury.
Right.
So working with the organizations, that has already saved lives. We already see a very strong difference in that, and due to the efforts of other agencies, not just the fire department on that. So
Right.
great.
Can I ask you, Karen? I mean, as a daughter of a person, a parent in another community, so luckily you're not going to his house, who constantly falls and asks for a lift assist. You know, what I've heard, and I don't know if this is true or not, but after a certain number of responses, some ambulance associations actually will tell the individual that they will charge them directly if they have to come out again. Is that not something that we do or can do?
First of all, that's a horrible thing to say to
Yeah,
somebody.
well, I'm just saying, this is
Because
what
I
I've-
never want to deter somebody from calling 911. So
Right.
the recent rules have been that we are, by the state of Connecticut, we are able to bill for non-transport calls or lift assist based on certain requirements. We have not started doing that yet. Some services have. I'm just a little bit on the fence because you need to, I'm not sure I want to ask a 90-year-old person at 2 o'clock in the morning, hey, do you have your insurance card, after we've just lifted her up off the floor and put her back to bed. But there is a way to bill for that. But again, to me, that's just part of the service. We're there to help you and to do whatever you need. If you need to go to the hospital, we'll take you. If you don't need to go, we won't take you. If you need outside services, we'll refer you to the police department to get that started. That's kind of the way we've always worked. So I just have not quite swallowed the idea of billing for something like that. So, but threatening somebody with that is not appropriate at all.
No.
So.
Chief Bolter, you were trying to get in with a question, I think.
Yeah, thank you.
I mean-
Just wanted to make sure that we were kept in the loop with the falls, since the officers are first responders and go to all of these.
I wonder, Maria, if it's an opportunity for the town manager's office to maybe coordinate a follow-up with basically everybody here, just to make sure that we're all getting the same information. Obviously, I don't need to be part of that, but I can leave that to you guys.
And this is Kristen. If I can just jump in also with a comment on this. My department receives the reports of the 911 calls for seniors, and we follow up. And we'd love to be part of that conversation too, so that we have the information, we can relay it back to the person again regarding fall prevention programs and any other ways that we can help them.
Excellent.
That's great. Thanks, Kristen.
It's a good reminder. All right, so sounds like we'll probably have an update at the next meeting on all of the good work that you folks have collaborated on. And again, another plug for this meeting. Folks wonder why government has meetings sometimes, and I think you guys once again have shown the value of getting together and just talking. So appreciate that. Any other questions for Karen? All right, Karen, appreciate your update this morning.
Thanks.
Chief Baldus, I'll start with you on fire.
I'll let Patrick actually give his report first, so that's fine.
My apologies.
Oh, no apologies.
Patrick Torville, Fire Marshal, go ahead.
Alrighty, not much to talk about. We have some major public gathering events coming in. Of course, we know this weekend will be the fly-ins. So I've seen the notices go out about traffic and everything else in town. But that event will be occurring now. I'd like to commend both the promoter of that and also all the town agencies for getting together again and having a great successful meeting on talking about all the impacts that could have on the community. They've did a bang up job on actually promoting and getting information to both the police department, us, ambulance, everybody. Brad and his crew has been phenomenal on that. Also out there, the plans for Latimer Lane School, that'll be going under construction come the fall time here. All those plans have been submitted and approved, so you can see some action going on at Latimer Lane School. Fire Prevention Week kicks off next week, October 9th through the 15th. Fire won't wait, plan your escape is our theme, as I had told this group before. The Fire District and the Simsbury Volunteer Fire Company will be out doing public fire education throughout the month heavily during this time. We tend to always go a little heavier this time of the year, throughout the year as well. But we'll be out reaching out to civic groups, all the schools, and things like that, promoting fire safety. Also, we'll be also tying on to that is the preparing for the winter months, having people get ready for cleaning their chimneys, making sure their equipment has been serviced to reduce our hopeful impact on chimney fires and CO related events within the homes. So that information will be going out to the public as well. We're also just still waiting for a few submittals for apartment buildings, more apartment buildings, just we all want to see, talking about increasing the numbers. But we'll have a couple new apartment buildings going up on Castor Bridge Crossing, and then hopefully the Iron Horse project will begin soon. With that, the other thing I just wanted to bring up is during our one of our private events down at the Performing Arts Center, we had a fireworks show. It was a private wedding. Actually, the people that actually threw it on were actually the people that do our fireworks throughout the year. It was their wedding, and they liked Simsbury so much they had their wedding here. And but the concern was the public. We had a lot of complaints about it. It was an unknown event, and that the fireworks were obviously very alarming. We usually get complaints about fireworks regardless, but this time around it was a little bit more because it wasn't associated with one of the normal shows that we have throughout the year. Everything was done completely legal, permitted, everything was proper. However, the topic came up, is there a means to actually notify people in town when a fireworks show occurs? And we'll be working with the town in that to get that publicized when these things happen, so some people can prepare for that. We did do it with our recent Simsbury Farms celebration. We put up signs and everything else. I think it was very well done. Maybe that's a model we could follow as we move forward. I received no complaints on that show, so hopefully maybe that notification process worked out well in that form, and we'll try that again in the future.
Appreciate that.
That's all I have.
Yeah, Patrick. Yeah, and I believe the PAC as well is going to be proactive day before, day of on any events that trigger fireworks down there as a result of some of that feedback. So.
Sean, can I just add one thing?
Sure.
I want to just give a huge shout out to the fire department. We attended the fireworks for the Simsbury Farm celebration. We, like a lot of other people, instead of actually going to the event, because we all live near it, we kind of filtered our way through the golf course, and we really weren't sure where we were supposed to go. And even though it was dark and the golf course is pretty expansive, fire marshals were driving around on golf carts. They had it all set up. They caught everything in terms of, okay, you got to stay here, you got to go there. I mean, it was incredibly well run. And I just got to give you a big shout out, because that was a situation, given where they were going off, that certainly could have been dangerous, and it wasn't even a risk. So you guys just do an amazing job.
Thank you.
That's great feedback. Appreciate that, Nancy. All right, and Patrick, I do have to ask, what construction at Latimer? Because nothing.
They're putting an addition onto the school. They're basically going to be doing some classrooms. They're adding on a larger addition in the back side of it.
Yeah, no, I'm aware of that. That's not approved. We're still out to bid, so that's not happening this fall.
But their plans are all have been.
No, they're not approved. We got to go back to referendum on that, so that construction won't happen until next year.
Oh, okay. Yeah, we in the permitting process, it's been approved. We already signed off for the state permitting process on that.
That's interesting.
Not the town. I'm sorry, not the town process.
Okay.
That's for the state for bids and everything else.
Yeah. No, we're going out to bids. Okay, I just wanted to make sure, because I was like, wait a minute, what construction at Latimer? Because there's an aggressive timeline to get that back onto referendum, assuming the bids are going to come back in excess of what's been approved by the public. So.
Correct. Yeah. And that was just for the state, so they can move forward for funding everything else. Yeah.
Gotcha. Okay. All right. Thanks for the clarity. Sorry about that, because I was like, wait a minute, what construction happening this fall?
Yeah.
That's been a big topic for Board of Selectmen, Board of Finance, Board of Education recently. So, okay. All right. Now, Chief Baldus.
Yeah, that's fine. Thank
Here we
you.
go.
And this is good because Patrick can help me check off a bunch of things on my list. So that works out very well by having him go first. But as was mentioned earlier, and thanks, Nick, for your comments. And also I want to thank you guys for the help in putting together, I think, a very successful recognition and well-deserved program that we were able to hold last week here at the firehouse. Again, I'll underscore what Nick had said. Please go to the Facebook pages, either for the police department or the fire department, and capture that video. But also the media recognition was very well received. And I think the town can be proud of our first responders and the continued work that we do. And again, thanks for everybody for their support, and also a lot of the well wishes that we received. We ended the year for our typical summer concert series. We provide lighting and incident command protection for those events. Everything went without a hitch this year. A good job to all that was involved, and thank you again for that. Patrick mentioned some of the other fall activities that we'll be supporting as well. We have seen the opening of the Goodrich building at the McLean Center, which is a very, very large residential building, 5 stories from the rear side. Certainly one of our tallest buildings, if you will, from that perspective, and fully suppressed and alarmed and so forth. But we are now seeing a few more residential alarms in that building, so we are going to that facility a little bit more, but things have been working out quite well. Glad to see that in town, and I think it's a great addition to that complex. As we head into the fall season, I just want to remind people that we do have a no open burning ordinance, that we're not allowed to be burning leaves or brush, or that the cleanup that we typically do in the fall. Again, we want to make sure that our public stays safe and that we don't have any issues with that. So a reminder for that no burning clause. One of the things that we also look forward to once we hit the fall season is, believe it or not, Simsbury Celebrates. It'll be here before you know it, and a lot of planning will be going into that event in terms of the structure, the public safety measures that we have to take to make sure that we have not only a great program and celebration, but one that's safe. And we'll continue to do that through the incident command system that we actually put into place last year, and we'll continue and develop that further for this coming program. And I think, as Patrick kind of mentioned, getting ready for the heating season, we have a little bit of a concern this year. Because we expect obviously a much higher heating cost issue to be facing our residents here in town, and we recognize that and realize that, and that also sometimes means alternative heating use, for whether it be more fireplaces being used, wood stoves being installed, pellet stoves, or other heating implements, even electric heaters and so forth being used. Certainly another opportunity for us to send that public safety message to be very, very careful in anything that you use for heating, because that could always, if it's not done properly and carefully, that could result in a catastrophe in terms of fire. So something that we'll be monitoring very, very closely, and hopefully we will not see an uptick in issues this year because of additional costs for that. So I'll turn this over to Gary Wilcox from the Fire District, and I think that should conclude our report. Gary?
All right, thank you, Jim. What I was going to comment on, actually a couple of things with Nick's mentioning the ceremony that we had. That was a great time, and it was a great opportunity to reward and honor our first responders for what they did, police and fire. And one of the very interesting things was the homeowners themselves stood up and addressed the audience that evening. And one takeaway that I had was the husband had mentioned the fact that, he has seen a lot of fire movies or videos or whatever on television. And he said, let me tell you, it's nothing like that. Hollywood, when Indiana Jones runs through the flames and that kind of thing, that is nothing like you experience in a real emergency and a real fire. The other thing too is that the the speed in which today's fires travel, within minutes, that house became a real issue and a life safety issue. And they did say, and here's the public safety message, is that everyone needs to remember to sleep with their bedroom doors closed. So when that emergency, that kitchen fire does start downstairs, for the minutes it took us to get there and to be able to rescue those people, they were able to stay in the safety of their closed bedroom door and the bathroom door long enough to be rescued. If had they been sleeping with their doors open, they may not have made it to that point. So it's just very, very important on that side of it. The other thing that I wanted to mention was that we have a proposed rate increase in our water system. And when the water company deal was done back in about 2000, and I'm not sure if everyone is aware, but the fire district actually got involved back at that point in time, because we realized at that time that we had a very small, successful, affordable water company, and it was being eaten up by a big conglomerate with much higher rates. And the fire district, although we were a little late in our attempt, because the deal was kind of already made before it became public, but we actually tried to purchase that water company so that we could preserve that small company and low rates. It didn't prevail, and they said, nope, everything's going to be fine. And there were promises that were made. Nope, we will keep the rates low. We will not raise the rates. We will not match the rates with the rest of our company system. Well, guess what? That's exactly what they're doing today. And so we have had some meetings, we've had some conversations, and the town and the district collectively are standing on this, and we will take a position and do some formal addressing on that to try. And we're not opposed to a rate increase, but 30% is a little extreme. And so just so everyone knows, we will be doing what we can to moderate that increase. How successful we will be, time will tell. And that's it. Thank
Gary,
you.
that's a great reminder. And I believe, what was it, 5 or 6 years ago, Aquarian tried to raise the rates as well. And there was a public hearing on it that was very well attended by both fire department, town, and residents. So I believe there will be a virtual public hearing this time. Maria, correct me if I'm wrong, coming up, so we can make sure that folks are vocal there, right? And it's a challenge because there is infrastructure costs, right? And then there are delivery costs. And, the challenge with the small water system is the infrastructure costs can destroy a small company. But at the same time, we are self-sufficient from a water supply standpoint, right? And that all of our water is generated in 06070.
It is.
So that is, an interesting piece here. So, and I've often debated with Aquarian in public and private that we don't have a water supply issue, we have a delivery issue, and that they have not been able to keep the pumps up with the rising water demand, and that is a challenge, right? But there's plenty of water underneath the ground in the town of Simsbury.
There is.
So something that we need to continue to talk and be proactive with Aquarian from the town side, because certainly 30% is impactful for the fire department. And that translates to potential higher fire tax, right, for residents.
Sure, it's a double-edged sword. Now that 30%, that's also on the residential side.
Yes.
So
Wow,
not only
that's the second piece, right?
You and I are going to pay a higher rate for our water at home, but then we're also paying more in fire taxes, because, and we pay in upwards of $250,000 a year for just the right to use the water, whether we have a fire or not. Now, obviously, we understandably, we need to have the availability to the water. But
Right.
even when the water company replaces a main, I know it may be because there are additional houses being built, et cetera. But if on the fire side of it, we're charged by the inch of the water mains, and if they go from an 8-inch to a 10-inch, just to supply more houses, we're faced with an increase in our cost just based on that. So all those things to be considered. And yes, if anyone would like to join in on that public hearing, it would be certainly welcomed.
I appreciate that. And a good
One
reminder.
other revenue, also, we just thought about the delivery to the customer and consumer and the residential end. Also, there's also the availability of water for sprinkler systems on a standby charge, which will impact businesses as well.
Yep.
In the same direction with the rate increase.
No, it's a good reminder, Patrick. Thank you. And I apologize for not being able to attend the recognition event. I was out of town on business, but I did catch the footage on Facebook. So Chief and everyone else, thanks for putting that up there so that the rest of us who couldn't make it could see that. And sorry, Tom, I cut you off. No,
I think it was Maria, actually.
Yeah, sorry, it was me. Just I did, since we were speaking about the potential aquarium rate increase, we do have a lot of good information about that on the homepage of our website, including the dates of the 2 virtual public hearings that are coming up in October. So for our residents who might want to participate in that. And then also Tom and myself and the fire district have been working together on putting together a draft piece of correspondence that we could submit as written testimony for the public hearing as well. And that will be in the Board of Selectmen's upcoming packet.
Appreciate that coordination. And sorry, Tom, your face popped up on my screen, but I didn't realize who was talking. So apologize for the confusion there. But thank you for that reminder, Maria. All right. We will move on to Board of Education, although I did not see Neil. Okay. I'm sure Neil is missing us and we are missing him, but we will move on now. Tom, Public Works.
All right, well, good morning, everybody. Just a few announcements from Public Works. We're in the process of implementing a new work order system. It's going to be really helpful in that it's hopefully going to allow residents to report things like dangerous trees, drainage issues, sight lines, things that really can affect the public safety along the roadways. And we're also working with our Parks Department, so it's going to be one system essentially for all of the town. Also, in the event that we do have a FEMA level event, this is going to help us in that difficult in taxing reporting that we have to give them. The other thing, we've been working a little bit with the police department on all of the public gathering permits and the number of barricades that we've been putting out. This week's River Run, along with the fly-in, we're being very careful that we have to keep a certain number in reserve in case we do have an emergency event. But it's just wanted to highlight how much work goes into some of these large public events. And I think we're rolling out just maybe 75, 80 barricades this weekend for these events. And it's a lot of work. And the final thing is we are working with our local traffic authority group just on a number of intersection safety improvements. And we're going to hopefully be working on that through the winter and look to make some improvements next construction season. If anybody has any questions, if not, we're all set in Public Works.
Tom, I appreciate that. One thing, and I know it's not under your direct control, is it's Route 10 and that's a state road, but we have, well, if I don't move enough, my light goes off here. We have been made aware, right, of the challenges of the big Y light on the north end of town and the traffic back up there. And then anecdotally from my own observations, after the lightning strike and an issue there at the state lot on Route 10 on the south side, right before Abigail's at Old Canal, when that light flashed, it actually fixed the intersection problems. So when that light works, it causes intersection problems. And when it flashed, it got rid of them. So I think that's been a point of contention, I know, for years with that whole intersection going on and the state wanting to redo the bottom of the mountain and such. But
no, good point. And just by coincidence, I was able to talk to somebody at the DOT yesterday about that project. One of the things that they are a little bit behind on is all of the intersections are going to be replaced instead of with the traditional loop detectors where your car would drive up and it would detect your car there through electricity. Now they're going to be doing it with cameras. They're far more accurate. They have much more information. And just for whatever reason, they're a little behind in getting that technology rolled out. But I would expect to see that before the end of the calendar year.
Yeah. Okay. I appreciate that. That'll help. And especially with school back in session and such, that intersection visually becomes a challenge. And I'm sure from a public safety standpoint, Chief, you would want to jump in?
Yeah, sorry, just to comment real briefly on a very recent issue with the traffic light at Big Y. So there was a bunch of social media posts about it over the last maybe 4 days, and that has been resolved. There was a camera there that had stopped working.
Okay.
So it was not cycling properly, and they went out there yesterday, DOT did, and hopefully they fixed that.
Thank you. Appreciate that update. Yeah. Yeah. When Facebook gets all fired up, it's At least something's going on. So thanks. And again, once again, thank you guys for taking this stuff seriously and not just brushing it off as social media nonsense. There is value in making sure that we understand what's going on. So I appreciate you guys doing that. All right, Kristen Formanak, Social Services.
Sorry, good morning again. We are wrapping up our renters rebate season. So if anyone still would like to apply for the renters rebate program for the year 2021, please get in touch with us at our office and we will help you out. We are gearing up. We're starting our energy assistance season. We are going to be trying to help people as best as possible. We have a medical leave right now, but we still are encouraging people to call our office so that we can give them information on energy assistance. We're also concerned about the rise in heating costs coupled with lower dollar amounts into the Connecticut Energy Assistance Program. So we are concerned that our folks may have a hard time making it through the winter with their energy. So we're hoping to be able to help them. But I appreciate the reminders, and we will also echo those reminders about being safe with alternative heating sources. Pretty soon, we're also going to be gearing up for our holiday season, and this is my public announcement for that because our next meeting will be right before we distribute our holiday toys and gifts. So if anybody would like to participate in that program, please get in touch with us and we'll help you with that as well. And we are still very active in our food pantry. Right now, we're currently seeking donations for hygiene products and household cleaning items, as well as paper goods. Those are our top needs right now. If you'd like to make a donation, there's a bin outside of the food pantry, and you can also contact our office for help with that. Thank you. That's all I have.
Thanks, Kristen. Appreciate that. Any questions? All right. Nancy, now you've jumped in on almost every other topic, but do you have anything from the VNA side?
I really am sorry. I realize how mouthy I've become.
There's nothing to be sorry for. It's all good additions.
Only thing to share is obviously it is flu season. We have our vaccines. Our fridge is stocked. We have a ton of public flu clinics in addition to flu clinics at the agency. If randomly for some reason you just keep forgetting and you need a flu vaccine, just stop by the agency. We are set to take care of people like you, Sean Askham. So yeah, we have everything we need and we're ready to go.
All right. No, I appreciate that. And again, your work is touching every group here. So it is really important and appreciate all the insight you've provided.
It's comical, you know, there's tons of ways to get a flu vaccine, but there are so many people, especially the seniors in our community, that live for our little flu clinic. And if God forbid we don't have it, I mean, every flu clinic so far is overbooked. We've added extra nurses. We're not going to turn anybody away. If you don't have an appointment, you could still show up and we'll make sure that you get your flu vaccine.
Thank you for that. And again, we are creatures of habit, so it's important that we keep up the customs so folks are able to keep themselves safe. All right, any questions for Nancy? Sarah was having connectivity issues, I assume due to the storm, and I don't know, maybe Granby doesn't have quite as good of service there. So she did want me to update that the cell phone group reconvened and will be sending out a follow-up survey. They're working with the PD to address thefts and shoplifting. I believe that's been on the rise. Per some of the emails that Sarah has sent out in terms of distraction and folks coming in and stealing from some of our small businesses. So particularly concerning that's happening anywhere and certainly in our town. So continuing to raise awareness, and if you see something, say something, and obviously reach out to the officers and the chief if any event does occur. Mr. Massaro is not here, although Mike Berry sang his praises, so I'm sure he's very comfortable. I'm sure he would echo that we are in storm season and he stands ready. And Mark has been a great partner of all of ours. We are at the end here. Chris Peterson, anything to add? I know you've joined us.
Nope, just wanted to say I really did enjoy out of just admiration, respect, and awe the recognition ceremony last week at the fire station. Well done. So thank you, guys.
That's a great addition. All right. Thank you all for joining us this morning. Once again, I am so humbled by all the collaboration that you guys do and seamlessly how you keep our community safe. You guys do a great job, and it's certainly appreciated, as Chris said, by us on the Board of Selectmen, but by the greater community. So with that, happy fall, enjoy your days, and I will talk to you all soon. We are adjourned.